Welcome everyone to this live. Today we are here with our highly skilled, amazing surgeon here at Labiaplasty Surgery, Dr. Luster.
Hi.
Thank you for being here. With her experience and expertise, Dr. Luster is here to provide all the answers to all of your questions. Today we are going to talk about labiaplasty. So we're going to answer your questions about that topic. Question number one. What is labiaplasty and for whom is it typically recommended?
Okay, so when we're discussing labiaplasties, we are talking about the vaginal lips, where it's two different types, your labia majora and your labia minora. So typically, when referring to a labiaplasty, we're talking about the labia minora, your inner lips. So for women who have bared children or are getting up there in age, typically you can get some thinning down there and discomfort with basically like they can elongate or become discolored. Even in younger women, sometimes that's just natural anatomy. So if it's something that's functional that bothers you or just a cosmetic aesthetic reason for wanting a trim, we can discuss that.
We're talking about not these lips, okay? What are the common reasons patients choose to undergo a labiaplasty?
So like I said, sometimes as we age, we get thinning down there and some elongation of that tissue, and sometimes just your natural anatomy can lead to the same kind of issues. So if it's an aesthetic reason that you want fixed or functional, like, certain clothing are uncomfortable to wear, those would be candidates for a labiaplasty.
Can you explain the different techniques used in labiaplasty procedures?
So there's two main types of procedures that we can do. One is a labial trim, where we can get most of the tissue like long ways. And then there's another type called a labial wedge, where we wedge out a section of the labia and stitch it back together, kind of like a pizza or triangle. And that helps shorten it and tuck it back inside.
Wow.
Mm-hmm.
Can you describe the consultation process for a patient interested in labiaplasty?
So like most of our consultations, we'll meet beforehand, we'll discuss your aesthetic goals or outcomes, discuss if it's more of an aesthetic issue or a functional one, and kind of what to expect in terms of outcomes and recovery.
How long does this procedure take?
Procedure's fairly quick. It could take like 20 to 30 minutes.
Wow. Yeah, super quick. What procedures can be done in addition to labiaplasty?
Oftentimes, patients will combine this procedure with a labial fat transfer, which is when you take fat and transfer it to the labia majora, or the outer lips. Again, as you age, you can have some thinning in this area and sex can become uncomfortable. So I had a patient the other day that kind of coined this term labial puffing, which I love. So we can call it that, but you just add some fat into the outer labia and it kind of gives you a more aesthetic result and more comfortable.
Labial puffing?
Yes.
Okay, interesting. What is the recovery process like after labiaplasty, and are there any potential risks?
So recovery, you'll have significant swelling down there. Some of the biggest risks that we're concerned about are bleeding, of course, but everything is monitored in the OR. We get good hemostasis there, and the stitch that we use is dissolvable, so you don't really have to worry about that. But really, there's just no sex for 4 to 6 weeks, and you want to ice the area to reduce swelling. And that's it.
What kind of scarring can patients expect after labiaplasty, and how is it managed?
Most people, because the tissue down there is very thin, I've never really seen any keloiding down there or hypertrophic scars. Sometimes as the stitch is dissolving, it can be a little uncomfortable, but really it's the same tissue that's like kind of on the inside of your mouth. So if you like bite the inside of your lip, it heals very quickly. Often it doesn't leave much of a scar at all.
Okay, and last but not least, are there lifestyle considerations or restrictions that patients should be aware of before and after labiaplasty?
Well, with any fat transfer, if you were to have fat transferred to the outer labia or labia majora, you want to let the fat survive as best you can without any direct pressure. So for that, you have to do like 6 weeks of no sex, which is why that rule exists. Otherwise, you just want to keep the area really clean, monitor how the stitches are dissolving, ice it if it's getting super swollen, and just keep in touch with your doctor about your progress.
All right, good to know. So if you're interested in a labiaplasty, or what is it, a vagina puff?
A labial puffing or fat transfer.
Or a labial puff, contact Dr. Luster now so you get it done today. Thank you for being here.
Thanks for having me.
See you guys next time. Bye.
Bye.
I guess it ended.